Ever wondered how a substance as common as alcohol can cause life-altering changes in the human body? Alcohol, a seemingly harmless social lubricant, has been a part of human cultures for thousands of years. It's used in ceremonies, celebrations, and for simple relaxation. But this ubiquitous substance has a darker side. Alcoholism, or alcohol use disorder, is a chronic disease characterized by an inability to stop or control alcohol use despite adverse social, occupational, or health consequences. It's a widespread issue affecting millions of people around the globe, and its impact can be devastating not just for the individual, but also for their families and communities. The journey of alcohol, from that first sip through its complex metabolic pathways to its potentially harmful after effects, is a fascinating one. It's a journey that can lead to addiction, health issues, and social problems. Before we delve deeper, it's important to understand what happens when alcohol enters our system. When you take a sip of your favorite drink, alcohol begins its journey through your body. Imagine alcohol as an uninvited guest crashing the party that is your body. As soon as it enters your system, it's rapidly absorbed into your bloodstream through the walls of your stomach and small intestine. This process can be likened to a sponge soaking up water. From there, it hitchhikes a ride on your blood, traveling to every nook and cranny of your body. Now, this party crasher decides to make its grand entrance into the brain, where it really begins to stir things up. Here, alcohol acts on the central nervous system, the command center of your body. It's like a cunning puppet master, pulling the strings to slow down the nervous system's function. Alcohol mimics a neurotransmitter called gamma-aminobutyric acid, or GABA for short. GABA's job is to slow things down, calm the brain, and promote relaxation. When alcohol impersonates GABA, it amplifies these effects, leading to the feelings of euphoria, lowered inhibitions, and drowsiness we often associate with a few drinks. But the liver, your body's dedicated bouncer, is always on duty to deal with these party crashes. It metabolizes or breaks down the alcohol into less harmful substances through a two-step process. Firstly, enzymes in the liver convert alcohol into acetaldehyde, a toxic compound that's even worse than the alcohol itself. But don't worry, the liver doesn't leave it at that. In the second step, another enzyme turns acetaldehyde into acetate, a harmless substance which is eventually expelled from the body. However, the liver can only process about one standard drink per hour. If you are knocking back drinks faster than this, the excess alcohol remains in your bloodstream, continuing its joyride through your body and potentially leading to the negative effects of intoxication. Now that we understand how alcohol affects our body, let's look at the long-term consequences of chronic alcohol use. Excessive drinking over time doesn't come without its costs. Even the most resilient of bodies cannot escape the long-term effects of alcoholism. In fact, the damage it inflicts is not just physical, but also mental. The most notorious organ to bear the brunt of alcohol's wrath is the liver. This is because the liver is responsible for metabolizing alcohol. Over time, consistent heavy drinking can lead to alcoholic liver diseases, such as fatty liver, alcoholic hepatitis, and the most severe condition, cirrhosis. In cirrhosis, the liver tissue becomes scarred and the organ loses its ability to function properly, leading to serious health complications and even death. But the damage doesn't stop at the liver. Other physical health problems that can arise include high blood pressure, stroke, and several types of cancer, including those of the mouth, throat, and esophagus. The digestive system also pays a high price, with inflammation of the stomach lining, ulcers, and malnutrition being common among heavy drinkers. The effects of alcoholism also extend to the brain, impairing its function in various ways. This can lead to mental health issues like depression and anxiety, and in severe cases, can cause dementia and other cognitive disorders. The damage alcohol can do to the brain is insidious, as it often goes unnoticed until the damage is considerable. In addition to these direct effects on the body, alcoholism can lead to social and economic problems. It can strain relationships, lead to job loss, and cause financial hardships. Moreover, the cycle of addiction can trap individuals in a pattern of self-destruction, leading to even more severe consequences. Yet, despite the extensive damage alcoholism can cause, there is hope. Medical advancements have made it possible to manage and even reverse some of the effects of long-term alcohol abuse. The first step, however, is recognizing the problem and seeking help. As grim as these effects may seem, it's never too late to seek help and manage alcoholism. Remember, it's not about how far you've fallen, but about how high you're willing to climb. The first step towards overcoming alcoholism is recognizing the problem. Once acknowledged, the road to recovery may seem daunting, but with the right strategies and support, it is entirely possible to reclaim control over one's life. A primary approach to managing chronic alcoholism is through behavioral therapies. Cognitive behavioral therapy, for instance, helps individuals identify and change the thought processes that lead to drinking. This therapy focuses on developing coping skills to manage stress and triggers that might lead to relapse. Another form of behavioral therapy is motivational enhancement therapy, which aims to resolve ambivalence about treatment and inspire a commitment to change. This approach focuses on internal motivation and self-efficacy, encouraging individuals to take ownership of their recovery. Family therapy can also play a crucial role, especially in cases where alcoholism has affected the entire family unit. This therapy aims to improve communication and relationships, creating a supportive environment conducive to recovery. In addition to these therapies, medications can also be an integral part of the management strategy. Drugs such as disulfiram, naltrexone, and acamprosate are often used to curb cravings, block the rewarding effects of alcohol, and help maintain abstinence. Support groups like Alcoholics Anonymous and Smart Recovery offer a community of individuals who are also battling alcoholism. These groups provide a platform to share experiences, learn from others, and receive emotional support. The power of fellowship and shared experiences in these groups can often be a lifeline during recovery. It's important to remember that every individual's journey is unique, and what works for one may not work for another. A combination of behavioral therapies, medications, and support groups is often the most effective approach. The key is to find the right balance that works for the individual with the guidance and support of healthcare professionals. While managing alcoholism is a journey, treating its physical effects is equally important. The next step in our discussion will focus on the treatment for alcoholic liver diseases, so stick around as we delve deeper into this critical aspect of alcoholism management. The liver takes the brunt of alcohol abuse, but there are ways to heal. When it comes to alcohol abuse, the liver unfortunately is often the first casualty, bearing the brunt of the damage. But let's not lose hope, because there are ways to treat and heal from alcoholic liver disease. Firstly, lifestyle changes are the cornerstone of treatment. This starts with completely stopping alcohol consumption. Without this crucial step, liver damage will continue and possibly accelerate. A balanced diet, regular exercise, and avoiding tobacco also play significant roles in aiding recovery and improving overall health. In addition to lifestyle modifications, there are several medications that can help manage the symptoms and slow the progression of liver disease. For instance, drugs like prednisolone and pentoxifylline are used to treat severe alcoholic hepatitis. Other medications, such as those in the class of drugs called statins, can help reduce liver inflammation and fibrosis. In some cases, patients may be prescribed vitamin supplements, especially B-complex vitamins and folic acid, to correct nutritional deficiencies that often accompany chronic alcoholism. Now, cirrhosis, the most advanced stage of alcoholic liver disease, can lead to liver failure. In such severe cases, a liver transplant may be the only viable option. However, it's important to note that most transplant programs require a period of at least 6 months of sobriety before they will consider a patient for transplantation. And lastly, psychological support can't be underestimated. Counseling, support groups, and rehabilitation programs can all provide the emotional and mental support needed to navigate the journey to recovery. So, whether the treatment plan includes lifestyle changes, medication, or even surgery, the ultimate goal is to halt or slow the damage to the liver and to give it a chance to heal and regenerate. Remember, it's never too late to make a change for your health. It's a journey, and every step towards sobriety and wellness counts. We've embarked on a comprehensive journey understanding alcohol and its effects. We've delved into the world of pharmacology, understanding how alcohol interacts with our bodies, altering our brain chemistry and affecting our behavior. We've explored the long-term effects of alcoholism, a harsh reality for many, which can lead to serious health conditions, including liver diseases. We've also looked at how chronic alcoholism can be managed, focusing on the importance of a balanced approach combining medical treatment with psychological support. And we've discussed the various treatments available for alcoholic liver diseases, a testament to medical advancement, but also a sobering reminder of the consequences of excessive drinking. As we wrap up, let's not forget that knowledge is our greatest weapon. Understanding the effects of alcohol can help us make informed decisions about our health and well-being. If you found this video informative, don't forget to subscribe for more because you won't find me later. Remember, knowledge is power when it comes to your health.